Hi, my name is Holly McGuire, and I'm in the Masters of Nursing Family Nurse Practitioner program at Arkansas State. My project examines a local clinic's cervical cancer screening rate in female patients. Since cervical cancer is the first most common cancer in women, I thought it'd serve good purpose to research this topic more to see if a rural community aligned with current screening guidelines compared with the national average rate of 80%. The United States Preventive Services Task Force have updated their guidelines over the years. They no longer recommend screening anyone under the age of 21 years old, which has been a change that I've noticed since my first PAP test was recommended to be performed when I was 18 years old. Current guidelines are as follows. No screening for women under the age of 21 years old. Women aged 21 to 29 years, cervical cytology alone every 3 years. Women aged 30 to 65 years, cervical cytology alone every 3 years, or high-risk HPV testing alone every 5 years. No women greater than 65 get screened who have had adequate prior screening. Women who have had a hysterectomy with removal of the cervix and no history of cervical cancer receive screenings either. I performed a retrospective chart review on February 24, 2020. A total of 3 patients' charts met the inclusion criteria and were included in this study. The clinic was at 100% when reviewing the charts to establish whether the clinic was following the most recent guidelines from the United States Preventive Services Task Force. Limitations to this study include a small sampling size of only 3 patients' charts. It was found after the fact that the clinic refers most gynecological patients to a specialist OBGYN. This being so, it is recommended that female patients still get educated in the clinic about appropriate screening times and recommending the HPV vaccine to help guard against cervical cancer. Cervical cancer used to be the leading cause of cancer deaths for women in the United States. However, in the past 40 years, the number of cases of cervical cancer and the number of deaths from cervical cancer has decreased significantly due to women getting regular Pap tests. Thank you.